Good afternoon. I hope many of you were able to enjoy a nice weekend. Here in PEI, I feel like starting by saying, aren't we doing well together? Together, we have followed public health measures. Many people have self-isolated. Many people have been tested. And we have all taken our responsibility seriously to keep our loved ones and our community safe here in Prince Edward Island in the face of this pandemic. Today, once again, I'm able to say that we have no new positive cases of COVID-19. And this is day 12, I believe, that there have been no positive cases to announce. There are 159 new negative tests to report over the weekend. And again, our total has been 26 cases to date in PEI. Across the country, there have been over 46,000 cases of COVID-19 and more than 2,500 deaths. I would note that the doubling rate of cases in this country has slowed from, some of you may remember, the doubling rate was 3 to 5 days last month, and now it has extended to 15 days in terms of doubling. Also to note, the number of people under age 20 who have been hospitalized in this country is small. There have been a total of 17 people hospitalized in that age group. The largest percentage of hospitalizations in this country are in the age group of 60 to 79 years of age. As I've mentioned before, a crucial piece of our COVID-19 response in Prince Edward Island is our testing. And across Canada this week, we celebrate National Medical Laboratory Week. And I've spoken about the great work of Dr. Greg German and his team in laboratories across Prince Edward Island, but I'd like to express my gratitude for their work. Medical laboratory professionals are important parts of the healthcare team, and in most cases, their work goes unnoticed. I have the utmost confidence in our team and our testing capabilities. Our lab test results are extremely important and provide patients with answers to their health care concerns. COVID-19 testing helps us to isolate cases, to do good contact tracing, and is key to preventing the spread here in our province. In a short period of time, we have gone from sending tests away to now being able to do them here in Prince Edward Island. And this means more tests can be done in a quicker time frame, allowing us to act more quickly and efficiently to contain the spread. And I'd like to thank all the lab professionals on PEI for their excellent work. And the only time that I would want to at all make a comment about media reporting is if I am concerned that it may impact the health and safety of Islanders. And I do feel like I need to address an article that was published over the weekend. The article may leave the impression for some that testing here in PEI is not credible, and I want to clearly state that this is not the case. The key piece missing from the article is about standards and protocols that accredited labs in Canada are permitted to follow. And as I've just said, I have great confidence in the lab-approved and Health Canada-approved tests here in PEI and the whole team. And it is important to note, and I think this was in the article as well, what is true here and in many provinces, that the testing process has evolved during this pandemic. We are doing more tests, doing them locally, and with a faster turnaround than we did initially. The Renew PEI Together plan is now being finalized, and we look forward to sharing it with Islanders this week. The Premier made reference to the fact that he had 158,000 political advisors last week, and I feel like I might have the same number of public health advisors at times. And I think there are many opinions about how we should renew PEI together, and there are different approaches being taken across the world. The PEI plan is based on public health risk, and it's based on epidemiology, and it will continue to be based on the efforts to keep Islanders safe. And this means part of it doing monitoring, testing, contact tracing, and protection at our borders. I know We want to get our hair cut. We want to go out to eat at a restaurant. And some days more than others, we want to make sure our children are at school. And many businesses and organizations are eager to get back to the way they were working. But it's important that we continue to do this gradually, cautiously, and carefully, and do so in the weeks ahead. And the weeks ahead may be more challenging than the last number of weeks have been. We will be giving broad overviews of what measures will be relaxing and when in the days ahead. I know I may have mentioned this before, but I'll say it again. The opening of our borders for non-essential purposes will not be included in initial phases of the Renew PEI plan, and I know this is difficult. I'd also like to say that although you may see me on most days, I'd like to highlight an incredible array of people working behind the scenes. They work countless hours to ensure that Islanders have the information and the screening and the tools to help us all deal with this pandemic. And these are, in particular, the group of people who are part of my team, and I thank them. But we are all part of a team, and it is part of doing this together. And we've talked about that, all of us. And together, following public health measures, step by step, we are getting there. Thank you. Et en français, encore aujourd'hui, j'ai un plaisir d'annoncer qu'on n'a pas de nouveaux cas de COVID-19 ici à l'île du Prince-Édouard. On a 159 tests qui sont nouveaux, sont négatifs depuis le week-end. Et au pays, on a plus de 46 000 cas et plus de 2500 morts. Si vous présentez avec les symptômes de COVID-19, n'hésitez pas d'aller vous faire tester. Un des éléments clés de notre combat provincial contre le COVID-19 est notre capacité de faire les tests localement. À travers le pays, nous fêtons la Semaine nationale du laboratoire médical. Je vous ai parlé de l'excellent travail du Dr. German et de son équipe et je tiens à les remercier de nouveau cette semaine. Ces professionnels jouent un rôle essentiel dans notre système de santé et j'ai toute confiance dans notre équipe et de nos capacités de dépistage. Les résultats sont tellement importants et nous donnent les réponses à nos questions de santé. Les tests nous permettent d'isoler les cas, de faire les suivis et de minimiser la propagation du virus. Ça veut dire que les tests sont plus rapides, on a plus de tests et donc on pourra agir plus rapidement aussi. Et un grand merci pour l'excellent travail. Nous travaillons le plan de relâchement et j'espère le partager avec vous cette semaine. Je sais qu'il y a beaucoup d'opinions de comment nous pourrions mettre le plan en place et qu'il existe plusieurs façons partout au monde. L'île est unique et nous devons avoir un plan qui nous est propre. Mais le plan est basé sur les risques de santé publique, l'épidémiologie et d'autres critères importants qui protègent les insulaires. Ça veut dire plus de surveillance, plus de tests, plus de suivi. Mais on doit le faire doucement, petit à petit, une étape à la fois. Les contrôles aux frontières ne feront pas partie des premières phases pour le relâchement. Et je sais que ce n'est pas facile. J'ai bien hâte de partager le plan de relâchement, mais et ça va arriver dans les jours qui suivent. Mais les consignes de santé sont toujours en place et on n'a pas encore terminé. On va y arriver petit à petit. Merci.
Thank you and good afternoon, everyone. I'd also like to start by recognizing this week as National Medical Laboratory Week and saying thank you to the many staff and physicians who work in Health PEI labs. Health PEI's medical lab physicians, technologists, and staff are the people who provide us with the COVID-19 testing and results. The service has been key to our response, and with these physicians and staff's dedication, it's been able to continue to meet our needs and it's been expanded greatly on the island to allow us now to get test results within a day. But they do a lot more than just COVID-19 testing. They provide services to all islanders, including anatomical pathology, blood transfusion services, clinical chemistry, immunology, microbiology, and a couple of services that are out there at the patient's side, like point-of-care testing for our blood glucose monitoring and many other tests, as well as specimen collection from our professional staff in the lab. We have community lab services based across PEI in Surrey, Montague, O'Leary, and Alberton community hospitals as well. They have done and continue to do amazing work. I want to say thank you to all the lab staff and physicians, and also hope they take some time to celebrate their great accomplishments this week. We continue to plan in Health PEI for the return of some services across our sites in the coming days and weeks. We need to do this safely as we continue to monitor and be prepared for any possible COVID-19 additional cases, and also be able to put some services in place that have been put on hold, but they may now safely be able to be done. We continue to offer the cough and fever clinics and the drive-through testing clinics, and those will continue in both Charlottetown and Summerside. Over the weekend, we saw 59 patients at our Charlottetown clinics and 14 in Summerside. A reminder that appointments to those clinics can be made through calling your family doctor or nurse practitioner or through calling 811. And I also want to remind people again that we do continue to offer essential services to Islanders, and that means that many of our programs and services are still available to you. Please call ahead to make sure your appointment is on, but if you do have an appointment, please attend and receive care. The services that are being provided today are very important for you to maintain your health. I also want to remind Islanders that we continue to offer strong mental health supports to our communities during this time. People looking for information on how to access these mental health and addiction services can call the COVID line at 1-833-533-9333 and select the option for mental health. Calls will be answered by a trained mental health and addiction staff member from 8 to 4 Monday to Friday, and any messages will be returned. Individuals who have urgent mental health and addiction needs can access services at the psychiatric urgent care clinics now available in Summerside, at the Prince County Hospital, and at the Hillsborough Hospital in Charlottetown. Information on other mental health services are available online at the princeedwardisland.ca/COVID-19 site, and if you look for the section called Mental Health Supports. Again, if you have an emergency, please call 911 or visit an emergency department near you. Our services and sites are safe, and we are here for you. Thank you.
And look forward to taking some questions.
Brian Higgins, CBC.
Yeah, good afternoon. With this better weather approaching and spring coming on, are you seeing less compliance with public health orders, more complacency about people's activities? Are you concerned? What sort of numbers are you seeing? And maybe the flip side of that, what pieces of information are you needing in the public health picture before you can loosen restrictions? Other provinces have loosened restrictions, so what pieces of the puzzle have they got that we don't yet?
Hi, Brian. So, I mean, the couple of provinces that have announced some loosening of restrictions, some of them would be starting May the 4th, for instance, varying dates as they go forward. But I think the big part of the question is absolutely we are sensing and seeing more people, for instance, out at the parks on the weekend. I know there were officials out there with ground search and rescue, reminding people about physical distancing. But it's the time of year people do want to start to move and get outside, and we are looking forward to doing so, and they want to see others. So, and I think that's going to be reflected in the renewing PEI Together plan, and really it's not only looking at what is going on around the country, it's around our epidemiology here, and wanting to make sure that while we don't have the numbers here, we want to make sure we don't all of a sudden have an outbreak. And when across the country, it's been very clear there should be certain criteria that are met before any relaxation of measures. And we have been looking at those. Those did come out of the WHO. They've been supported by Public Health Agency, and will also be captured as part of our go-forward plan.
Thank you.
Louise Martin, CBC.
Oh, hi there. Good afternoon to you both. My question is actually for Marion Dowling, please. You keep repeating the message, or urging people to still go to the ER if they have an emergency need, keeping their essential service appointments, medical appointments. Are you noticing a drop in the number of people coming to the ER or keeping their appointments? Are you worried that there are people who should be coming but perhaps are not?
Hi, Louise. I think that's been one of the messages that I wanted to bring, was that making sure that Islanders know our services are safe. We have means when people enter our emergency departments or come to our clinics. What we're offering right now are essential services, which means we really want Islanders to attend to those appointments. And we have all kinds of measures in place to separate people if they're in waiting rooms and that kind of thing, so they don't feel vulnerable and hesitate in coming to have any symptoms or health conditions checked or evaluated. And also, always we've been working on reducing the number of missed appointments even in normal times. So we do encourage people to please make time for their appointments. I think it is fair to say we've seen a reduction in our emergency department visits, and that isn't always a good thing if people are hesitating coming. So I just want to reassure Islanders that we are there, the services are available, it is safe to come. Please get help if you need it, and we will make sure that you're not exposed to COVID-19 in your way to accessing those services. Of course, we'd have other reductions in our emergency services with the minimal number of activities happening, less people driving on the roads. There's no sporting events happening at the moment for those types of injuries and things to happen as well. So we would expect some reduction, and I just want to make sure people know to please come and seek help for their health.
Thank you so much. Appreciate it.
You're welcome.
Carrie Wynn McLeod, Ocean 100.
Good afternoon. My question is for Dr. Morrison. Doctor, you mentioned about conditions, that need to be in place before any of the restrictions are lifted. I'm just wondering, how many new cases would it take in order for that Renew PEI Together plan to be kind of left on the shelf or pushed aside, either before the expected start date or during phase one? Or would it depend on whether any cases were travel-related or community transmission?
Carrie Wynn, I think you even helped answer the question there. So it would depend. I mean, the criteria is certainly to have the disease controlled in the province and not to be seen a spike of cases or outbreaks of illness. And in our case, we've talked about if there was one case and we could, and so it would depend. So if there was a case related to travel and we actually were able to do good contact tracing and they had self-isolated, for instance, it's a very different situation than someone who is positive and who had not self-isolated and been out in the community and had a large number of contacts that we would have trouble tracking, or if we had a positive case and we were not able to identify any exposure. So it will depend, and we're working closely with our epidemiology group in the office at exploring those potential options and what that could mean. And absolutely that would happen, that we'll be looking at that today, tomorrow, if that occurs, and also, as you mentioned, at any point in the next phases, and what that could mean in terms of having more restrictions in place if we start to ease up and see a lot of cases.
Thanks.
François-Pierre Dufault, Radio-Canada.
Bonjour, Dr. Morrison. Question pour vous en français. Est-ce que à ce moment-ci, vous avez commencé à revoir votre modélisation pour ce qui est du nombre de cas, du nombre d'hospitalisations, du nombre de décès possibles? Au moment où vous avez présenté ces données-là, le portrait était quand même assez différent et depuis ce temps-là, il y a déjà une douzaine de jours qui sont écoulés sans nouveaux cas ici. Alors, est-ce que vous pensez présenter un modèle à jour bientôt?
Exactement, François. On est en train de regarder et de refaire ces modèles et d'être prêt de les présenter encore. Et puis, juste comme vous avez mentionné, chaque semaine, vraiment, et chaque 2 semaines, on a des changements et puis ça change. Les modèles sont plus exacts, c'est pas vraiment exact, mais ils sont peuvent être plus bien utilisés si on a plus d'informations. Alors, chaque semaine qu'on se dépasse sans des cas, ça nous donne l'information on n'a pas beaucoup de cas ici, et puis ça change les modèles, mais on va encore en parler, j'imagine, plus tard cette semaine.
Merci.
Okay, merci.
Laurent Rigaud, La Voix acadienne.
Bonjour, docteur Morrison. J'ai une question très rapide. Vous avez dit qu'il reste 26 cas, qu'il n'y a toujours que 26 cas à l'île du Prince-Édouard. Les 2 dernières personnes qui sont malades, comment elles se portent? Est-ce qu'elles sont en voie de guérison?
Bonjour, Laurent. Ils sont pas à l'hôpital, ils sont chez eux, mais ils sont encore, il y a encore les 2 cas qui sont considérés pas guéris encore. Et des fois, il y a des personnes qui ont des symptômes qui durent un peu plus longtemps, ou s'ils ont été exposés comme quelqu'un juste aux dernières, à la fin du 14 jours, il doit être ils sont pas considérés recouverts avant un bon bout de temps, mais j'imagine, j'espère qu'on peut annoncer les 2 cas peut-être par la fin de semaine. And just in English for the 2 questions, one question was on modeling. We presented some models a couple of weeks ago, and we are, of course, looking at the modeling, and we said that we would continue to do that, and what does that look like, and particularly looking at what it could mean for our numbers and our cases as we do some easing up. So we'll have more conversation about any modeling as we go forward. And the other question was about the 2 people who have not been considered recovered, and we should have some indication by the end of the week on those remaining couple of cases.
Stu Neepy, The Guardian.
Hi, good afternoon to you both.
Hi, Stu.
I suppose this would be a question for Dr. Morrison. Just at the end of last week, a poll or a survey released by Narrative Research found a much lower proportion of people in Prince Edward Island where cloth masks or gloves in public places than the other 3 Atlantic Canadian provinces. I noticed that New Brunswick is requiring face coverings as they sort of ease back their public health restrictions. So wondering if at this point you would recommend that Islanders consider wearing face coverings in public, and will this recommendation be part of ease-back measures in PEI?
So, hi, Stu. So the sort of non-medical or cloth masks, we're actually going to be having some language come out at the same time as our plan, because we anticipate that as a question and part of the consideration. And certainly in most places, it's not a requirement, or it's a consideration to wear cloth masks, and it also depends on the circumstance. For instance, cloth masks or non-medical masks are not meant to protect yourself. They're really to protect other people, and they would be considered and we've talked about it here before, but they would be considered in circumstances where you may need to be closer than 6 feet for a period of time, such as on public transit, on a bus. And but we think it's important that people understand the details around that. So we are going to be putting that, making that available, and even if some of the important parts of making sure you wash your hands, for instance, before you put any mask on. And of course, it's different in every province in terms of the rate of community transmission that is apparent. And but there's been some pretty general, consistent messaging around the use of non-medical masks in the country, and we'll continue to do that here in Prince Edward Island. Okay, thank you very much, and we'll talk to you tomorrow.